Okay, we're going to have a look at what physical activity actually does to us. And I've sort of looked at kind of a broad range of physical activity kind of experiences. You'll kind of have experience of some of them yourself, others maybe less. I've even included referees, albeit looking at a video monitor here. Now, what I want to do is I want to initially focus on what I want to do directly is I want to focus on the muscular system. So let's think about the muscular system. What do we think is going to happen to this thing when we are exercising? What is going to be the effect of this? And basically what I want to sort of claim to you is that we've got a bunch of positive influences to the muscular system, and we got a bunch of, I don't know, let's call them negative or drawback effects on the muscular system. So let's sort of start on the positive. They're fairly easy, really, when we think about, obviously, physical activity is pretty damn good for us. So these are some of the things. Now, this is after months and years of being physically active, okay? We would have an up arrow, an increase in cross-sectional area of muscle. So the muscle itself is going to hypertrophy. It's going to get bigger. It's going to get thicker. Now, of course, there is a direct proportional relationship between the cross-sectional area of muscle and the amount of force that it can produce. Also, we get an up arrow, an increase in the percentage of the relevant muscle fiber group. Now, let's be clear what is meant by that, okay? I am saying that for Johnny Peacock, who is my 100-meter sprinter just here, he, through his training and his performance, is going to develop lots and lots and lots of fast-twitch type 2X fast glycolytic fibers, because that's what's required, and that's what his training is effectively doing in there. Other things, we get an increase in pair coordination. Now, that could mean all kinds of things, such as how one juggles a type of fruit, but I'm not spelling that kind of pair. We're talking about antagonistic muscle pairs here. Muscle pairs such as the bicep and the tricep working more coordinated. The 4 quadricep and the 3 hamstrings working in a more coordinated way together. That, of course, helps with things like technique. We also get an increase in strength, specifically force output of a muscle. Come back to cross-sectional area. We also get an up arrow, an increase in strength. You think I'm going to say the same thing, through a full range of motion, a full range of motion. So let me just go and see what's a good example of that from our imagery. So let's say here, for our badminton player, this shoulder is going to be able to apply strength when in this position, this position, this position, this position, arch back over her head. You know, that full range of motion is going to be available in terms of force output, maybe for a clear or a smash when that performer's playing badminton, for example. We also get an up arrow increase in extensibility. So the muscle can actually become longer. This actually happens, by the way, because we switch the stretch reflex, which is what sort of tightens the stretch up, will happen later in a greater range. We also get an increase in tendon transmission. Remember that tendons themselves are the tissue that transmit force from the contracting muscle onto the bone. We also get an increase in capillaries or capillaries at the muscle. Okay, so although that's a vascular consideration, of course, it has an impact on the muscular system, because of course then we can obviously dissociate more oxygen, get more oxygen into the mitochondria for aerobic respiration. Now, we've said here there are negatives, so that all seems pretty convincing, pretty compelling stuff. What's negative? Well, first of all, exercise can cause temporary post-workout pain. Now, funnily enough, this is something that people can apparently learn to enjoy, right? And we might have a name for this. This is called DOMS, the delayed onset muscle soreness. It's also sometimes called exercise-induced muscle damage. We're going to look at these in other tutorials, but I'll just sort of throw those in there. We might also have the possibility of strain. Now, remember, strain is damage to a muscle, a tendon, or the sheath that connects or surrounds them both, and therefore we might have possibility of possible tendon or muscle tears. Now, of course, these would be more significant than a strain. And also, this one's, I think, an interesting, comes from what we said before, possible risk to working health. Now, that sounds really sort of possible risk to working health. That sounds like really dramatic when I say it that way, but let's imagine someone's got a completely ruptured, torn hamstring. That person's, I don't know, a postal worker, works in a factory, is a PE teacher, has got to do something physical. Then of course they're going to have time off. That's a problem. Now, I also want to have a look at the effect of exercise on the immune system. Okay, so let me just tag immune system in here. Now, I'm not going to get into the immune system. I'm going to assume that you are aware of the specific immune system of phagocytosis, antitoxins, and antibodies. I'm not going to get into the biological teaching of that. I have taught that extensively on the site if that's something you want to have a look at. But again, what are the positive impacts of exercise on the immune system? So what do we have here? Okay, so let's just say that we are talking about acute exercise. You know, we are doing some kind of exercise now. What is its direct impact? And it is considered to be what's called an adjuvant. An adjuvant. Now, those of you that speak any romantic language will know that this comes from helping or facilitating. So acute exercise is healthy for the immune system. It helps us to sort of achieve those things. It helps us to have a nice, healthy, robust immune system, which of course helps to keep as well. Now, other things. We've also got what's called an inverse relationship. Okay, and I want to give you the two variables that are in this relationship. We have got variable 1, which is illness risk. So illness risk is inversely proportionate to the second factor, which is what's referred to as moderate training. Okay, so assuming we don't overdo it, go crazy, burn out, moderate training will cause us to have a far lower risk of illness. That's a really, really good thing. That's because exercise, one of the things that it does is it is what we would call an anti-inflammatory. Okay, so it has an anti-inflammatory effect on the body. Okay, so it has a positive effect in reducing swelling, etc., etc. It has an inflammatory approach on us. Also, the other thing we can say that's really good for our immune system, if we talk now about ongoing exercise, you know, I'm thinking here about the whole of life, for example. You know, I've been exercising my whole life, for example. What this does, it causes a decrease in age-related dysfunction. You know, that could be things like osteoporosis, that could be things like arthritis, things that tend to happen as we get older. They're less likely. And the other thing is that because we tend to take on more carbohydrates if we are exercising regularly, one of the things this does is it supports immunity. So those additional carbohydrates we might take as a carbo-loading diet or post-exercise nutrition, that is going to be healthy. Now, there are negatives. Okay, so there are negatives. Now, I wonder what you think I'm going to write here. So the assumption is that intense exercise, the more intense you do it, you're going to up your illness risk. You know, this idea of burnout and doing too much, okay? So obviously too much by definition would be that. So we can also sort of say that overtraining, now we're not just saying training hard here, the term over is definitive. It's saying too much. It's going to increase illness risk. And I just want to remind you of low energy availability, LEA. If a person experiences LEA because of inappropriate energy balance, this is going to again introduce a greater risk of illness. So it's a combination of training to the right levels, not doing too much, and refueling sufficiently. Now, I'm not going to get into REDS and those conditions. There are other tutorials if you want to go and have a look at those. Now, finally, guys, we are getting a bit of a long tutorial, this one. I just want to think about other effects. Oh my God. I'm going to call it long-term training. So long-term training or long-term exercise. What are we going to experience? Well, we get a decreased risk. I've already mentioned this. Osteoporosis. Remind yourselves, the bone is made up of a matrix. If you think about muscle fibers are kind of structured like this, and they're sort of in lines like this, you know. You sort of have them all lined up like this. Well, bone doesn't work that way. Bone is like a matrix of calcium-based fibers. You know, it's right, intertwined. Think of it a bit like carbon fiber. And what happens is, the more of this we have, the less likely we are to have osteoporosis. Now, it needs to be like that because bones need to have what's called tensile strength. They need to be strong, but they need to flex slightly as well. They need to be able to bend just slightly. That's why we experience that one. Now, going a bit further, we also have a decreased risk hypertension. Hypertension is chronic high blood pressure, and of course that's less likely if we are exercising regularly. We also have a decreased risk of coronary heart disease, or CHD, things like stroke, angina, heart attack, myocardial infarction. I'm not going to get into too many of those here. We also have a decreased risk of type 2B diabetes. This is lifestyle diabetes, where we overwork the pancreas and it becomes unhealthy and unable to do the work we need it to do. And we also get a decreased risk of obesity. Now, obesity itself, of course, is considered what we would call a comorbidity. Okay, a comorbidity. And what we mean by that is combined with other conditions such as CHD, hypertension, combined with things, it can cause issues including death. Okay, now obviously I'm not saying that can happen overnight or it happen when someone's just a little bit heavier. No, we're saying obesity, when combined with other factors, is potentially dangerous for people. Now, to finish this off, guys, I just want to think about the however, because there's always the other side to the argument, right? So let me just say, however, before I tell you to go and get in the gym and go and get exercise and all those sorts of things, we really need to think about some other things. There are negatives to exercise. Some people can develop what's called a health obsession. Now, I'm not going to talk about individuals, but I have some people in my life in this situation, and it can be hard to deal with if I'm completely honest. People who do dynamic sports, think tennis players, rugby players, etc., dynamic sports, these can really lead to joint injuries, okay? And even, you'll find that people who are more likely to have sort of knee reconstructions, this sort of thing, they'll tend to be sports performers, so knee, hip issues, this kind of thing. Also, people who maybe experience, especially osteoarthritis, let me put that in, osteo is effectively damage to the cartilage in the joints. That's more common in sports people. And we can also say things like tendinitis, the inflammation of tendons, especially if we don't warm up properly. And I'm just going to mention to you an additional term called epicondylitis, which is a type of tendinitis, and we call it things like tennis elbow, golfer's elbow, for example. And last one, I just want to mention to you ITBS, which I always struggle to spell this. It's iliotibial band syndrome. It's for people who run lots and lots of miles and kilometers, and it's pain on the outside of the knee up to the hip because of the rubbing of the fascia tissue that runs in that part of the body. So although exercise is excellent for us, we've got some negatives, and we also must remember those ultimate drawbacks. This can be something we need to consider.